What's going on, guys? Welcome back to another episode of Inside Equity, the home of real news for our people, our culture, and our community. I'm your host, Michael Nichols Pierce, representing the Racial Equity Consortium, and today's topic is something that is new to me, and I'm honestly looking forward to hearing more about it, and also to just addressing the need for it within our community. I know us as men, us as women, and just as a community as a whole need to be more informed of it. So what better person to have it than the subject matter expert, a dear mentor of mine, the one and only Miss Lindsay Griffin. How are you today?
I'm doing well. How are you?
Not too bad. Thank you so much for taking the time out to be with us today.
My pleasure. Thanks for having me.
Of course, of course. So today's topic that we're discussing is Black maternal health and reproductive justice. So can you please just give the people and myself some insight as to what that is?
So I'll start with reproductive justice because it also incorporates Black maternal health. So reproductive justice is a framework that was developed in the 1990s by 12 Black women. One is Loretta Ross. She is an amazing scholar, activist in the field, and reproductive justice has three main tenets: the right not to have a child, the right to have a child, and the right to parent in safe and sustainable communities. And Black maternal health comes into that picture because the whole reason reproductive justice came about was because of the fact that there needed to be more discussion beyond the white feminist, pro-choice, pro-life debate. And so much of Black maternal health, you can't just talk about not having a child and having a child. You have to talk about it all together because there's so many aspects of Black women's health and Black women's maternal health that is impacted by so many different policies and systems in our society.
So if you don't mind me asking, what was it that got you to start to dive into this topic?
So I am currently pursuing my PhD in social work at Bryn Mawr College. And when I first came into the program, I was really focused on Black families that were involved with like multiple systems. I had came from working at the state of Delaware in the children's department, and I just felt like these families are being tasked and asked to do things that I could not figure out how to do. And so I went to school, focused on that. But when I got there, I was really more drawn to perinatal mental health, issues with fertility. The fertility issues are related to my own personal fertility issues. I had to go through IVF for both of my kids. But then I just started getting drawn into these other spaces. I got recruited to be a board member for Postpartum Support International, the Delaware chapter. And I was also facilitating a fertility support group with the clinic that I went through. And when I started to just come across different information around like Black maternal health disparities, Black women's disparities with fertility, I was just like, wait, this is a thing. This is like something much bigger than even my own experiences, and seeing how my experiences kind of fell into these buckets of folks that were experiencing the same thing. So as I was going through literature, reproductive justice kept coming up, and I was like, what is this framework? And so I just started going in and reading everything I could get my hands on by Loretta Ross. And I was like, this is what I want to focus on, because this is aligned to social work. It's social justice focus. With reproductive justice, there is the demand for policy changes to help support those that are at the margins of our society. And so with me, I was just like, since that time, my first year, I've been very focused on reproductive justice and just trying to focus the work that I'm doing in my program, research that I'm doing, and writing papers along the lines of reproductive justice to get it out.
You mentioned your own personal story falling in line with some of the buckets of the things that you were coming across. So prior to you diving into the literature and information and doing deep diving research and just going through the experience yourself, how was that for you, if you don't mind sharing?
Not at all. I don't mind sharing. So for me, as I said, both of my kids, I had to go through in vitro fertilization, IVF. Um, what happened with me was that for years and years, I was going through life where I was having very painful menstrual cycles. Every month it would come. I would literally be on the floor in a
Mm.
ball. My husband could even testify to say about that. Like, I would be curled up in a ball. I would feel like everything from my waist down was just in agony. And would go in for my well women exams, and they're asking, well, how are your periods? Painful. And they're like, do you take any medicine? Yes, of course.
Mhm.
Does it help? Sometimes. And then it's moving on to the next question. So I was diagnosed with stage 4 endometriosis when I finally ended up at the fertility clinic that my husband and I use. And it made me angry because of the fact that I went so long with having no answers.
Mm.
And endometriosis is categorized almost like cancer in terms of like stage 1, stage 2, stage 3, stage 4. And I'm like, my body didn't just get to stage 4
Right.
overnight. But one thing with our society, women are typically dismissed with pain, and Black women are even more so dismissed whenever they're talking about issues of pain. What was interesting was when I started doing a little bit more research on endometriosis statistics. So, endometriosis typically for any woman it takes about 8 to 10 years for them to get diagnosed. Black women, it's 10 to 12.
Mm.
And I was like, oh, right on the head, 12 years. I remember in high school, I ran track, and I remember having really painful menstrual cramps, 16 years old, and like could barely walk. And I did not get diagnosed until I was 28 years old. And I was like, this isn't okay. But there's so many other reproductive health disparities that Black women experience. PCOS, Black women are more likely to have issues with PCOS. Fertility, Black women are more likely, up to 2 times more likely than white women to have issues with conceiving, but nobody talks about that.
Mm.
Whenever people see Black women, and unfortunately it's still even with doctors, they believe, oh, you're a Black woman, you're not going to have any issues with getting pregnant. That's not the case. And it was unfortunate that it took as long as it took for me to get diagnosed with endometriosis, because there are different treatments, lifestyle changes that can be done to help manage it to prevent it from progressing as quickly. Um, but those options weren't given to me.
Right.
I wanted to conceive. Here, your fallopian tubes. Sorry, they're pretty much shot. So we have to go through the process of IVF. And it's sad to me as well that by the time I walked into the doctor's office, I already had my master's in social work. I'm an
Right.
educated woman. Like, I shouldn't have like these negative type of outcomes associated with me. I'm
Right.
educated. And I did not know at 28 years old that fallopian tubes and ovaries are not connected to each other. And I was like, why is it that this information isn't readily available? Why
Right.
is it that people don't know what their bodies are doing or what their bodies should be doing? So, they said reproductive justice really advocates for like people having access to information about their sexual health or reproductive health. You know, your reproductive system isn't just for baby making, is something I say.
Mm.
And it's something that is important to take care of for your lifetime. So it's like thinking about young girls who are, middle school, high school, they're going over to the nurse's office every month around that time. It's like
Right.
we should be stopping and asking why, what's going on. Can we get a little bit closer look at it in terms of like what's happening? Um, but oftentimes it's just, oh, you're in pain. Okay, take this heating pad, take this Aleve or this
Mm.
Advil, and then just keep chugging along. There's not a lot of exploration, and that's, to me, I feel like that's wrong.
You made the comment of being told or hearing people say, "Oh, you're a Black woman, you're strong." For you being a Black woman, do you feel as though that's dismissive?
It is dismissive. It is dismissive. Um, and that's another issue that is relevant to reproductive justice, is that, Black women in terms of like even being able to like do gender, like being feminine, soft, like that's that's not something that we really are afforded in our
Mm.
society. And then a lot of this goes back to, I like to talk about history and talking about the fact that, Black people, Black bodies weren't brought into the United States until 1619. And when Black women were brought in, we were brought in to reproduce a slave workforce. Um, while Black women had to be out there and they had to be, working the fields or working in, quote unquote, their master's house, like one of the big values that they carry, especially when things started to be eliminated with the transatlantic slave trade, was that the only way to keep slave bodies around was for Black women to carry more children for there to be more slaves. So our reproduction is really tied to history. And then also within times of enslavement, Black women's bodies were experimented on without the use of antiseptics, without the use of anesthesia. Black women would be having to hold down other Black women's bodies as they were literally like cut open.
Mm.
And it's horrendous to say, but again, this whole notion of like, oh, Black women are strong, Black women don't feel pain comes from that era because of the fact that doctors, they essentially pass around this belief that Black bodies don't feel pain, or they don't feel pain to the same extent. So it's like, oh yeah, I can whip that slave over there and yeah, he went out and then he worked some more. And it was dehumanizing
Right.
for Black people. Black people were not seen as equals. We did not have rights. We were seen as objects to be controlled, and the purpose of being controlled was really to produce a profit with these different, with these different fields, cotton, um, things like that. And so unfortunately, even still today, these notions of Black bodies don't feel pain is still something that we see come up. Hence why Black people still have such high health equity disparities, health outcomes that was demonstrated live and in color with COVID,
Yeah.
where many, many Black people died unnecessarily and were not able to access adequate care.
Yeah. It's crazy that today we're still being told that Black bodies don't feel pain as much because of what we were forced to endure 400 or 500 years ago.
Mm.
And it still plays a part today.
Yes.
And that says a lot about the state of our country, for one, our
Yes.
health system, healthcare system, and honestly, just as we're viewed as a society.
Mm-hmm.
So, back to present day, when it comes to some of your research, what are some of the things that you found that have just been interesting, that were kind of enlightening to you?
I think there's just been like so much. I think one of the things that has just continued to hit me hard is just all the facets of Black women's health and the poor health outcomes. Again, we talking about maternal health and the fact that Black women are 3 to 4 times more likely than their white counterparts to die related to pregnancy complications.
Why is that?
There's still not a whole lot of research that really goes into that, but from what I've reviewed and seen so far, I think a lot of it comes down to Black women aren't listened to by their doctors,
Mm.
by their medical providers. I think about, Serena Williams. That's a big name that when she had her first daughter, and the fact that she had an aneurysm before, and doctors just were dismissive, and how she had to advocate so much for her to just be heard is ridiculous. Like, we so often put a lot of stock in to doctors. They have these medical degrees, they went through all these years of schooling, and yes, that's great, but at the end of the day, if you're not listening to your patient, Like, we are the experts of our own bodies. It's really the medical doctors, the professionals to really take their medical knowledge and listen to our stories, our expert stories about our bodies to help navigate with us what's going on and what needs to happen in terms of like medical care.
Right.
And unfortunately, I think what is coming up time and time again, because a lot of times when they do like these reviews later on and saying like, what was the root cause analysis? Like, what happened? What went wrong? Um, the patient wasn't listened to. The patient vocalized discomfort. They vocalized something didn't feel right, and they're dismissed. And by the time that they're listened to, it's too late. And that's not right, because there are so many, children growing up without their moms. There are, husbands and partners that are having to raise kids without, their wife or partner present. And that's, especially when it's something that's preventable. And a lot of times when they do these root cause analysis and reports come out, they show that it was a preventable death.
Mm.
That if there would have been adequate treatment given, if there would have been adequate intervention, then that would not have been the outcome.
As cliche, not even cliche, but just nonchalant as it may sound, it's almost as if in some cases you have a few doctors, quite a few, that just honestly don't care about us.
Sometimes it feels that way.
That's how it sounds.
And I think there are some that don't care.
Yeah.
And that's the thing that is really scary, is that there are some that really don't care. I wouldn't say that it's all,
Of course
but I'd
not.
say there's like good and bad and all. I mean, there are some social workers that I've come across, like, oh, you really don't care.
Yeah.
Okay, got it. But again, it doesn't take much to spoil the bunch. It doesn't take much for one bad doctor to have a significant lasting impact on a person or community. Again, because of everything that I was talking about with times of slavery and the way that Black people were experimented on or subjected to like medical treatments that were like they were trying to develop. Still to this day, there is still a huge lack of trust with Black people in the medical community.
So me being a man, I'll never know what it's like, of course, to give birth. But of course, I will be supporting my wife when that time does come. What are some things that I could do to help be supportive and be an advocate for my wife or for a loved one who, can be going through a childbirth?
Excellent question. One thing I say, if you can get a doula, because doulas are meant to be the person that's advocating on behalf of the birthing person. If you can't have a doula, because there's still a lot of restraints related to costs, being able to advocate, being able to access one, listen to her. And if doctors are not listening to her, you step up and you say, hold on, my wife is saying X. I need you to take a look. Even if you think that everything is good, fine, and dandy, I need you to take a look, because she's saying that she's in pain or she's feeling like something is off or something is wrong. Never be afraid to speak up. And it's like, we shouldn't have to do like all the extra advocating. We should be able to say once, like, this doesn't feel right, doc. Can you take a look? Can you check this out? And they should, but it's not always the case.
Yeah. You said that you went 12 years without being diagnosed. And the average Black woman is diagnosed within 10 to 12 versus white women being, I believe it was 8 to 10.
Yeah.
What are some ways that we can be able to capture some of these diagnoses early?
I think a lot of it comes into play with education. I think so often, our school systems, I give them credit, they do try to do a lot, but I think there's something to be said about having like such short sequences around like health. And a lot of times when you go into like reproductive health or sexual health, it's like you get a chapter in a 20 chapter book, and
Right.
it's not enough. We really need to be doing a better job. One, for those of us who are parents, trying to educate our children on their bodies at home. But we need to make sure that for kids that don't have consistent parents or, in foster care systems, like, we need to make sure that there is a curriculum that speaks to sexual and reproductive health in schools. So again, the fact that at 28 years old with a master's degree, I didn't know fallopian tubes and ovaries weren't connected together. Um, Having adequate representations in books about like, okay, what are some of these common reproductive health diseases that impact folks? What may they feel like? What may they be experience? What people may experience with them? Like with endometriosis, I always talked about how I felt like there was like a dull knife being dragged from like my stomach all the way down through my legs. And lo and behold, I go into research and I'm finding articles that talked about feeling like being stabbed by, 1,000 tiny little men with daggers. And it's like, that's it. And it's like, again, if there's language that we have to communicate what our experiences are, I would hope, one, that if everybody's getting this education, even those in the medical system, that they'll be like, okay, you shouldn't be having pain quite like that with the
Right.
menstrual cycle. And you shouldn't be having your periods like have you flat out laid out. Um, so that's one thing. And then the other thing is just really making sure that these doctors are taking the time to listen and follow up and ask questions, not just, okay, you took some Aleve, you took some Advil, did you feel any better? But if the answer is no, what happens next? And I never experienced that. I did not get I think you have endometriosis until I was sitting in front of my reproductive endocrinologist, the fertility doctor that I initially saw. And that's like, why did it take that long? It shouldn't have taken that long.
Right.
Especially when I have been seeing, you know, gynecologists for years by that point.
So, for, by this point, you said that you've been seeing gynecologists, let's say, for the 10, 12 years.
Yep.
And again, I'm asking because I don't know. I don't experience these things. How is it that you can see so many, or not so many, but go to a doctor so many times and see different people and no one catches it?
It's not uncommon. That's another thing that literature shows is that it, it may take some women 3, 4 different doctors that they see before they actually get a accurate diagnosis. And you have to wonder what's happening. And that's where a lot of my interest is coming in for research. I'm looking at, shared decision making process with Black women and their health providers because I want to understand like what is the process, what's happening, what is she talking about, what is the doctor's response, are they coming to a mutual plan that seems like that the Black woman feels like is satisfactory
Right.
for her and her health and well-being, or are they giving enough options to say like, well, maybe we need to think about, having you do an ultrasound, or having, if we can't get anything from the ultrasound images, maybe we need to stop and think like, do we need to do a surgery, some exploratory surgeries such as a laparoscopy in order to go in to actually be able to clearly visualize what's happening in your body. Because ultrasounds, x-rays, they're only going to go so far in terms of being able to see. And typically the gold standard for diagnosing endometriosis is having to have a surgery called a laparoscopy.
So you mentioned that it's not uncommon for women to have to go to get a second, third, fourth opinion.
Yep.
And in your research, have you come across anything that clearly says what I guess you kind of mentioned it, but what was it that the doctor figured out, or what procedure was different than the other 2, 3, 4 that they saw prior to?
I think part of it is that they start to get to a point of saying like, we need to look and go ahead with surgery. And the thing is that surgery can be hard. I mean, the good thing with laparoscopies is that it's minimally invasive. They put a scope, typically it's like through your belly button, and then they make any other incisions around your abdomen that they need to go in to be able to visualize different areas. But not everyone has the ability to take a few days off of work,
Of course.
or a few days off of school in order to have that done. So that's one area that makes it harder for endometriosis. Other reproductive diseases such as PCOS, polycystic ovarian syndrome, you could do a blood test and they could be able to see like, oh, this is probably what's going on. They also with PCOS, they could do an ultrasound because they could visualize the ovary with like multiple follicles developing and saying like that shouldn't be the case. Um, Other things like fibroids, which is something that disproportionately impacts Black women. About 80% Black women are walking around um, with fibroids. Again, that's something that you can visualize off of an ultrasound. Endometriosis is so tricky because of the fact that you have to be able to go in
Right.
to look at it. And unfortunately, not every doctor is trained on being able to recognize what it looks like. There is a woman who is a big advocate about endometriosis in Delaware, and she said that when she first had a laparoscopy, the doctors thought that she had cancer. And she wakes up from surgery and like all her family is around and they're like, you have cancer. And then she goes to find out from somebody else, like, no, you don't have
What?
cancer. You have endometriosis. And this was a white woman. Yeah. And I was like, that is horrifying. And it's scary, but it goes to show that even these doctors, even though they spend years going to medical school and residencies, they still have limited knowledge and
Right.
understanding. So
It's not funny.
I know it's one of those you just gotta take
Wow.
a breath and you're like, what? Yeah.
Wow. To tell someone you have cancer
Yes.
and to come to find out that it's not that.
Yes. Yes.
Wow. So for you, with your process, we talked about the history, we talked about the facts, and thank you for sharing your story. When you were going through the journey of IVF, you and your husband, how was it for you guys emotionally and mentally?
Woo. So for me, I'll never forget that time, especially before I had my first one, but even going through the journey again for baby number 2, I was very emotionally devastated. Now, mind you, my mom actually had fertility issues as well. So she didn't have to go through IVF, but it took her some years before I came along. She had a pregnancy loss before me. And then it still took her a couple of years before I came around. And so I knew, at least because my mom had shared this information with me when I was younger, that, okay, I know my mom has had issues, so there is a possibility that maybe I might have fertility issues. I wasn't ever expecting it to be to this extent. Um, but I remember sitting in my room and I would just be sitting and like just depressed. Like, why is this happening to me? Why is it that, I can't get pregnant? I just want to be a mom. And it's like it's this desire I've had in my heart for years. And I work with people that are trying to conceive in the private practice therapy group that I work with. And it's there's not enough words to explain what it feels like if you haven't gone through it, because of the fact that it's just like it feels like it's something just out of your reach. And until you get that positive pregnancy test, you're just constantly in wait. And with IVF, there's a lot of like hurry up and wait. It's like, okay, we're gonna bring you in. You're gonna need to have this surgery. Okay, you get the surgery done, and then it's like hurry up and wait because now you have to let your body recover. Okay, done with surgery. Okay, now we're gonna get ready for doing an egg retrieval. So now you're gonna have to be on all these hormones, these steroids, and all this, and it's not. It, for me, I had a hard time with the egg retrieval process because my abdomen got so distended. It was uncomfortable walking around. I say I was very, very blessed during the time that I was going through IVF because the supervisor that I had was extremely supportive. Still a friend to this day. And he was like, no, you just take it easy. I know you're getting your work done. You're
Yeah.
good. Um, but it's also a time where it felt very isolating. So, like, outside of having my mom to talk to, I didn't have anybody
Mm.
to talk to about what it was like to be wanting a child, going through all these procedures, going to all these appointments, because that's the other thing is that when you're going through the egg retrieval process and you're on all these medications, you're basically going into this clinic like every day or every other day for monitoring appointments. So that's when they're taking blood work and they're also doing ultrasounds. So through this process as well, it's not uncommon. I know I experienced this where I was just like, I felt like kind of blocked out from my waist down. Like, I just felt like here I am as a science experiment, and the clinic I went to was like great in terms of like the professionals there really made you feel like a person. It didn't feel sterile. Anytime I was having different things done, it just felt like everybody was rooting for you there. But still, it's like there's a lot of poking and prodding, um, especially for the woman's body, because that's the body that will be carrying the
Right.
baby. Um, but yeah, I know for me, I felt very isolated. I felt very alone. Like I said, dealing with depression, there was a lot of self doubt, like in like combating the thoughts, like, "Oh, you're damaged goods," and I would be
Mm.
looking at my husband like, "You're not gonna leave me, are you?" He's like,
Mm.
"No, I'm not gonna leave you." He's like, but it's like these are the things that it wasn't just me, but these are the things I also hear from like the women that I work with, like having this sense of like guilt, and it's like I eventually got better, but a lot of times I say like, okay, I didn't choose my body. I didn't choose for my body to have this. I didn't do anything intentionally to cause me to have endometriosis to the point where I wasn't going to be able to conceive naturally. Um, so emotionally it's a lot, and it's a lot to navigate, and I think that's part of the reason that fuels my passion for doing the work that I do in my private practice
Yeah.
with women that are trying to conceive, because I know what it feels like to be sitting and having these doubts and going through these challenges, all while you still have to show up to work. If you're at school, you gotta show up to school. You
Mm-hmm.
gotta, you can't go into your room and hide and cut yourself off. I mean, people can, but it's not a healthy way of
Right.
coping.
So, one, thank you for sharing that, because that's beautiful for you to be able to now be on the other side. But it takes a lot of strength for you to be able to say that publicly.
Yeah.
What are some of the things that you share with the people, who that may be going through it, or someone who may be viewing, and maybe looking at this like, wow, she got through it, I can too, seeing that you've been through it firsthand and you've been doing intense research on the topic?
Yeah. One thing I always tell people is don't go through this journey alone. Like, you have to have a support system. Um, and that's another reason why I love reproductive justice, is that there is a big component of storytelling in reproductive justice, as part of self-help. But it's like when we hear people's stories, it gives hope.
Mm.
When we hear people's stories, we are encouraged. And when we hear people's stories and it sounds like our own, we feel seen and we feel less isolated. So one of the things I always tell people, like, don't go through it alone. Get on a support group or find a therapist that specializes with working with folks with infertility, because at least they understand, they get it. It isn't having to explain, the different acronyms, and there's like a whole bunch of different tests. It's like, okay, when a person says to me, "Oh yeah, I had that HSG the other day, and oh my God," I'm like, "Oh yeah, that one hurt." It's called a histosalpingogram, and it is not a pleasant test. It's a test where they push a dye through the cervix to see if fallopian tubes are open, and it's painful. So
Mm.
it's like, but people don't have to say what it is when they tell me that. I'm like, yep, I know what that is. Okay. Oh, you had to have the cyno. It's not as bad as the HSG. Okay, cool. How did you do with it? How was it for you emotionally? How did you get through it? So I'm able to really try to focus more on the emotional aspects and the mental health aspects, and less about like, can you sit and like explain that to me,
Right.
because of the fact that I have the lived experience. Yeah.
So, what are some resources or steps or for someone who may not know their status or they want to get pregnant and they may be, oh, well, I don't know if I can or can't. What are the first few steps that you would recommend they take?
So, first, if you are looking to conceive, have a conversation with your OB-GYN about that. If you have some concerns that there may be something that may be off, bring those things up, ask questions. A lot of times you don't have to automatically go over to a reproductive endocrinologist to get help. OB-GYNs may be able to do some basic kind of tests, like for women, being able to test their egg reserve, their ovarian reserve is called an AMH level, anti-Müllerian hormone is what it stands for. That's an easy blood test. It's
Mhm.
non-invasive. As long as you can handle needles with the blood test, it's something quick and easy. And that is something that's important because there have been women I've seen in my group that I facilitate that are in their like lower 30s, like 31, 32, that have what they call like a depleted egg reserve. And what makes it problematic with that is that they may have some eggs, but you never know what egg is going to be developed in a given menstrual cycle in a given month. And so if there isn't much, you don't know if you're going to ovulate or not. And so sometimes with IVF, that might be a good, some women may end up going through IVF because of that. But again, that's information about your body. If you're having painful periods, please talk to your doctor. And if they seem dismissive, find somebody else
Mhm.
because painful periods is not normal. You're not supposed to be in pain and you shouldn't be bleeding for really more than like 5, 6 days. And that was something else with me is that I was bleeding, spotting for like 2 weeks in a row. And I was like, something not right.
Mm.
Something's not right. If you're having GI upset, nausea, diarrhea, those kind of things with the menstrual cycle, seek help. Something's not right. Because it shouldn't be, especially if you're finding it's a consistent thing. It's one thing if you get like a stomach bug going around, but if it's a regular thing, those are actually signs of endometriosis as well.
Wow. And I just know so many women who, to your point, cry like they're dying when they're
Mm-hmm.
going through their cycle
Yeah.
and not knowing that someone like yourself had the same exact symptoms, and then years later come to find out it was much worse than what it was portrayed to be.
Yes. Yeah. It wasn't just, oh, you're just having a bad period. No, no, there's really no such thing. And I think that's a problem because, again, like I talked about endometriosis, I talked about polycystic ovarian syndrome, I talked about fibroids. There's also a disease called adenomyosis, which is basically like endometriosis, but it grows into the uterine lining, whereas endometriosis tends to like grow outside of the uterus. It's not uncommon for it to go through the fallopian tubes and then attach to other structures in your abdomen and organs. There have been women who have been discovered with having endometriosis on their lungs and cause a collapsed lung.
Mm.
That's how intense and how crazy endometriosis can be. But I mean, there's so many different things, and there's so many things that have to go right with your reproductive system in order for, a healthy pregnancy to take place.
Wow. So, question for you: you went through the process. You now have your beautiful family,
Yes.
two beautiful children. You're in school for your doctorate. How much time do we have left?
I'm hoping about a year and a half I'll be done.
So, in less than 2 years, you will be Dr. Lindsay. What's next for you, if you don't mind me asking?
So I will be looking at jobs, obviously. I do a lot right now. I'm teaching at 2 universities and doing part-time private practice. But I'm hoping that I get into an academic space as of right now. Because one, I want to do research. I want to really do qualitative research because I love stories. I love hearing people's stories. And I think our stories have the capacity to help usher in change. When we're seeing, Black women talk about their experiences with doctors and being dismissed and all, we can take those stories and then like from the stories make policy recommendations
Mm.
for how should medicine be practicing in whenever they're in rooms with patients, like how should they be engaging their patient and making sure that they are providing adequate care. We want and it's like when I think about adequate care, I don't think about care just to get you by. I want to be thriving in my life. And there's so many people that unfortunately are not thriving because they're not getting this adequate care that they should be getting.
Yeah.
Uh, so, like I said, I want to do research because of the fact that I want to have these stories and be able to make policy recommendations and intervention recommendations from these stories. And then I am actually really finding that I am enjoying teaching. At the school I go to, Bryn Mawr College, I am teaching the first ever reproductive justice and social work praxis course. So it's really neat.
Congratulations.
Thank you. So it's a course that I developed, and I'm working with future social workers, and it's so cool because these are people that are going to go into communities. They're going to be working with individuals. I have some that are going down a clinical track, so thinking about becoming like mental health therapists, and I'm working with those who are also on the macro track who are thinking big policy changes. And it's powerful that I'm able to give them exposure to knowledge and information that I wish I had
Mm.
when I was back in my master's program, like 13 years ago. I'm like, that number is getting big. I don't know how. But it's exciting because I know that they're going to be able to use these tools from the very beginning in their career.
Mm.
Whereas this is something that I only just came across within the past few years, and I wish that I had the knowledge and information because so much of the work that social workers do, we're in communities. We're supporting parents, we're supporting families, and we want as much as possible to keep these community structures
Right.
intact. We want people to be able to go outside the house without fear of violence or gun violence. We want to be able to have kids go through schools where they're safe and they're not bullied so that way they can learn. We want kids to be able to be fed and have safe, stable housing so that way they don't have to be thinking about at school, what's it going to be like going home?
Right.
Will I get enough to eat? Like these are all the things that are around reproductive justice, and that's what makes me so excited about it because like reproductive justice is racial equity. Reproductive justice really focuses on, Black people, queer people, you know, all the people that are on the margins of society and really bringing those folks into the center and saying like, what is it that they need?
Right.
Because when the margins are benefited, the majority gets the benefit too.
Mm. So yeah, you didn't have to drop the bomb and just leave all these gems like that. You literally just dropped the mic just now.
I did.
So, Ms. Lindsay, thank you again for your time. Where can the people find you?
Ooh, so I do have a website, lindsayngriffin.com. So I have a blog that I haven't updated in a little bit, but you will find some information related to like mental health therapy and reproductive justice. When Roe v. Wade fell, I had wrote a piece around why that terrified me as someone that works with the fertility population because so often I've seen women groups where they have had to terminate a pregnancy because of fetal anomalies, genetic reasons, and the shame that they struggle with. I was like, nobody should feel shame for accessing health care that
Right.
they needed. And that's why I'm very big about, respecting people's rights to bodily autonomy. Another tenet that's within reproductive justice, like people have the right to bodily autonomy. But yeah, you'll find me on there. I'm not really active on social media right now because I got my hands in so many other things.
Absolutely.
But lindsayandgriffin.com, you can find me there.
And we'll be sure to add it below at the bottom of the podcast. So again, I just personally want to say thank you for the insight on and off camera, because again, you blow my mind every single time we have this conversation. I'm just sitting here with my jaw on the floor, just because again, more people need access to this information. Men, women, black, brown, white, and alike. We all just need to know this because it's important for our community, our women, and just our society as a whole.
Absolutely. Well, thank you so much for having me. I really do appreciate it.
Absolutely. And you will be back, I hope.
Oh, I plan to be. I plan
I hope
to be.
so.
Yes.
So again, thank you to Ms. Lindsay for coming out. Thank you to the Dr. Daniels of Don't Judge Me Productions. Thank you to the one and only Michelle Washington, a woman of More Creative Group. And of course, to JR the Kid Productions of the 5th Media Headquarters. This is Michael Nichols Pierce from the Racial Equity Consortium. Until next time, peace.